America's Web Radio on the AmericasBroadcastNetwork.com. Thank you for listening.
Welcome back into the Doctor's Lounge. I'm your host, Dr. Hal Scherz. Each week, myself and my co-host, Dr. Scott Barber, bring you the information that doctors talk about in doctors' lounges all across the country. We try to inform you about the issues in healthcare so that you will be able to make decisions for yourself and your family regarding your healthcare, and be informed about what is happening in the world. The show is brought to you by the Docs for Patient Care Foundation, which is the only physician-led healthcare think tank in the country. The Docs for Patient Care Foundation has always stood for the doctor-patient relationship and for healthcare freedom. That's what we are working towards every day and fighting for, and we need your support, and you can help us to help you by going to the website www.d4pcfoundation.org and support the foundation and the work that we're doing. The work never stops. It's a non-stop issue. Today, in fact, you'll hear President Trump announce his new health care plan, much of which has been influenced by the people in the Docs for Patient Care Foundation and the work that we're doing. So look for that on line and read about it, and then go to our website and support us. We can't continue to do that work and this show without your help. So please do that right now. Just go to the website, click, and you can donate $5 or $500, but that's something that we need your help with. So, every single day is something new. The world seems to change on a dime, and everything is so different today than the last time that I did this show 2 weeks ago. And if they say in Atlanta, where I live, that if you don't like the weather, just wait around an hour and it will change. And I think the same can be said about the political climate in this country. If you don't like what's going on, sleep on it, and the next day something new will happen. And what I'm really referring to is what now we're confronting with the debate over the Supreme Court, which is something that we will get to in a moment. This show, as I said in my lead-in, discusses the issues that we talk about in doctors' lounges all over the country. And when the Supreme Court issue came up, it was something that we're talking about in doctors' lounges, and had an opportunity to do that on Monday and talk with a few of my colleagues in the lounge in the hospital where I work, the Children's Hospital in Atlanta. And it's amazing that people who are on the left are so monolithic in the way that they think, and the opinions that they have are formulated by the talking points that they are subjected to in the outlets that they listen to. And they talk about there are buzzwords, there are catchphrases and trigger words that they love to throw out. This Supreme Court justice debate gives Trump the opportunity to put in place somebody who will support the white nationalist view. And I looked at these people and I just could not believe what they were what nonsense they were saying, and I asked them if they believed that I was a white nationalist, and they really couldn't they couldn't answer that question, because they know that I'm not. And yet, if you're a conservative, if you differ from, excuse me, I'm not COVID, dry throat. If you differ with the positions of the left, and you deviate from their woke positions and their talking points that they all are saying at the same time, then you can't have a thought that is contrary to what they're saying and be anything but a white nationalist. And it's really pathetic, actually. I really feel sorry for these people, because they don't like Trump. That's why they believe this, and they believe that there's black and white, and there's only two ways of looking at things. And I don't mean that in a racial connotation. I mean that there's no shades of gray anymore. Shades of gray was, the middle. That was the way that our country operated for 240 years, and now we are on teams. And if you're not on my team, then you're on the other team, and you have to believe what I believe, and you can't have a differing thought. Otherwise, you can't be on my team. This is very dangerous, and very, very. The end point of this is really quite disturbing, because there does not seem to be a place in the middle. And I was reading some of the writings of Douglas Murray, who is a political commentator from Great Britain, who has written a number of books, and he loves America. He's a big fan of America, and he's a big fan of the American system, and he believes that right now we are in the same position that we were in 1859. There are two competing views of America. There's traditional America, and then there is leftists, communists, socialists, Marxists. You can call them whatever you want, but those people believe that America is a bad place, that we were founded illegitimately, that nothing is good about America. And if you take that position, that nothing is good about America, then there can never be compromise. And that's his point. And so we are now, unfortunately, locked in a ideologic war, which Douglas Murray believes can have no end other than a civil war. And he really hopes that won't happen. Nobody hopes that will happen. But if you are a student of history, and again, you have heard the famous quote that those who fail to study history are doomed to repeat it. And we are, unfortunately, at the same crossroads that we were at in 1859. And he sees no end in sight. And this Supreme Court nominee, right now, last time we did a show, the two big issues were about COVID and about about disorder in the streets, about riots, about burning, looting, defunding the police, and that has those are still major issues, sadly, but they've been pushed aside by the shiny object of the day, which is the Supreme Court nominee. And I'd just like to take a moment to acknowledge Justice Ginsburg, who was a remarkable woman. She should be applauded for standing up for her views. I disagreed with a large number of her decisions and the way that she viewed the world, but she was a person of tremendous conviction. She was a trailblazer. She did things to help large numbers of people in this country, particularly women, standing up for women's rights. And so I feel like you can be honest and still oppose the things that she stood for, but acknowledge that she was a great person, a great American. She gave a lot to this country and supported the things that she believed in. So I wish to send condolences to her family, and may she rest in peace. So with her passing, and people have knocked her on the left because they claim that she should have stepped down when Obama was president and he had a Senate that was Democrat, that they could have gotten through an appointee to take her place, and they may be right. But nonetheless, I think that she was hoping that Hillary Clinton would be president, that Hillary Clinton would nominate one or maybe two justices, and she would be the grand matriarch of the left wing of the Supreme Court. And sadly, she miscalculated, and now we have a situation which the left is claiming is a constitutional crisis. And the only constitutional crisis that we have would be to not appoint somebody to take her place and leave the Supreme Court with an even number of justices, where if there is a contested election after November 3rd or November 4th or November 14th, or whenever they declare a winner based on the nonsense that's happening around the country with late ballots by mail, this is almost certainly going to go to the Supreme Court, and they are going to adjudicate who is going to be the president. And God help us if there's an even number of justices and it's a 4-4 tie. This will send the country into a true constitutional crisis, and we cannot have that. So there needs to be an odd number of justices, just like the well, I'm not sure. I don't know the answer to this, and I don't want to say something out of school, but I'm not sure that the number of justices on the Supreme Court is outlined in the Constitution, but just the judicial branch. Let me take a moment and talk about the Supreme Court. And I want to talk today about how important the Supreme Court is for health care, because if you think for a moment that this is not an essential issue as far as your health care is concerned, then you have not been paying attention to what has been going on in this country for the past 10 years. First of all, right now, there are 8 justices who are on the Supreme Court. And historically, throughout the modern history, or throughout the history of this country, there, to my knowledge, and I could be corrected, there have been 9 justices since the Supreme Court's inception. And people have tried, they've threatened to increase the number of judges on the Supreme Court if they didn't get their way legislatively or judicially. The most notable of those was Franklin Roosevelt when he was trying to get through his socialist agenda during the New Deal. He got pushback from Congress, and he threatened to pack the Supreme Court with activist progressive judges who will uphold executive orders that he was creating to go ahead and fulfill his vision for the New Deal. So the Congress caved. They agreed to pass the legislation that he supported, and he dropped his threat to pack the Supreme Court. But that threat has always existed, and interestingly, only on the part of Democrats, only on the part of the left. The right never, the Republicans never threaten to do something that would be so blatantly unconstitutional or unprecedented setting. Now, people are claiming that having a nominee go through at this time is against precedent. And again, they're wrong, because the president is required to nominate somebody. Obama did that. He did that with Merrick Garland. And Merrick Garland didn't get through because the Senate was controlled by Mitch McConnell and the Republicans. And that is the prerogative of the party in power, that they decide what nominees they're going to bring to the floor and which ones they're not. And Mitch McConnell decided not to, and that's the prerogative of the party in charge. And that's why elections have consequences. So nothing has been done that was irregular or unconstitutional. Obama did it, and Trump is going to do it. He's going to put through a nominee. Now, Mitch McConnell and the Republicans are still in charge. The difference between the Obama administration and Merrick Garland and President Trump is that the same party is in charge of the White House and the Senate. So this time, this will go to a vote. Let's talk about the Supreme Court. You know, it's very interesting. When you look at the Supreme Court, you talk to people about the Supreme Court, you know, the Jimmy Kimmels and the others who do the man in the street kind of interviews, asking questions about the Supreme Court. First of all, young people know nothing about the Supreme Court. Now, all of a sudden, they're woke about the Supreme Court because their media leaders are telling them what to do, what to think, what to say. But they still know nothing about the Supreme Court. They don't know, for example, how many justices are on the Supreme Court. And if you ask a young person to name Supreme Court justices, other than Ruth Bader Ginsburg, who no longer is with us, it's really questionable whether or not young people could name one Supreme Court justice, let alone more. Now, the Supreme Court has 8 justices on it currently, and let me just run through who those people are. The senior person on the Supreme Court is Clarence Thomas, who's 72 years old. He's been on the bench in the Supreme Court for 28 years, and he was nominated by George Bush 1. Then there's Stephen Breyer, who is 82 years old. He's been on the bench for 26 years, and Bill Clinton nominated him. Then there's John Roberts from Bush 2, Sam Alito from Bush 2, Sonia Sotomayor, and Elena Kagan from Obama, and then Neil Gorsuch and Brett Kavanaugh from Trump. So if you look, there are three justices who were appointed by Democrats: Stephen Breyer, Sonia Sotomayor, and Elena Kagan. They all vote pretty much the same. The conservative judges don't. They've been unpredictable. They've actually looked at the merits of cases, and they've not voted ideologically, and much to the chagrin of conservatives, especially with the Chief Justice, John Roberts, who many conservatives blame for allowing Obamacare to continue to stand, and we'll get into that in a little bit. But of the justices who are sitting on the Supreme Court right now, there's one who is in his 80s, that's Stephen Breyer, and it's looking like he may wind up not finishing, or he may need to be replaced at some point in the presidency of the next president. Clarence Thomas is 72. He shows no signs of slowing down, but he's the next oldest. So there's one justice that needs to be replaced, and possibly another one with the next president. So there is an opportunity right here to make sure that the Supreme Court is filled with justices who honor the Constitution, who interpret it the way that our founders wanted to interpret it, and not change the interpretation based on what is happening in society today. The left likes to claim that the Constitution is a living, breathing document that is subject to modification based on the way that society is progressing. And we know how that's working in our country right now, with tearing down statues and canceling people who believe differently than the woke left does. So I think that it's really important that this branch of government, the third important branch of government, the highest court in the land, is filled with people who are not going to try to alter the United States, because right now we are, as I said earlier, locked in a civil war of ideology, and we need to have the Supreme Court honor what our country has been, which is the greatest country in the history of the world, and to make sure that it does not get dragged down the rabbit hole that the left wants to drag it down. Healthcare is very much on the agenda for the Supreme Court. And I want to talk about this because the justice that fills Ruth Bader Ginsburg's seat is going to be an important vote in terms of what happens to your health care in the future. And let me, I'm going to finish up with that, but I'm going to talk about how the Supreme Court has impacted your health care up until now. And there have been Supreme Court decisions for decades that have had some health care implications, but none more obvious, none more important than those that occurred after the passage of Obamacare. Now, if I can make everybody put on your thinking caps and remember back, I know it's a long ways, it seems like a long ways ago, but June of 2012, this was 2 years after the passage of Obamacare, there was a lawsuit that made it all the way to the Supreme Court that centered on the individual mandate. Now, if you recall, people were stating that the government had absolutely no right to mandate that people have insurance. This was viewed as commerce. It was stated that the government could not make you buy something that you did not want to buy. It's as if the government said that you had to buy a Buick or you had to buy a MacBook. This was the basis for the lawsuit against the federal government. So there were lawsuits that made it all the way to the Supreme Court that centered on the individual mandate. And in a 5-4 decision, with the deciding vote being cast by by John Roberts, the Chief Justice, appointed by a Republican, he claimed that Obamacare, the ACA, was constitutional. The mandate is allowed to stand because it was viewed to be a tax, not a penalty, but a tax. And the Congress, the House, has the purview of being able to approve, vote on, and pass legislation that has to do with taxation. So, consequently, the penalty for not having Obamacare that was levied, that was the mandate, was viewed to be a tax, and consequently, the mandate was constitutional, and Obamacare was constitutional, and it was allowed to stand. And so that had tremendous implications from that point going forward, which we are still arguing about today. And that all came from the Supreme Court and interpretations of what is constitutional and what is not. They were also asked, the Supreme Court at that time, to weigh in on the expansion of Medicaid, if you remember. What the Obama administration wanted to do was to withhold funding, federal funding, to states that refused to expand Medicaid. And states that were run by Republicans, many of them refused to do that. And the court ruled 7-2 in favor of the states that refused to expand Medicaid, that it could not be coerced by the federal government to expand their Medicaid programs. And if a state chose not to expand Medicaid, that the federal government could not withdraw Medicaid funding to that state. But the court also decided that if a state chose to expand the Medicaid coverage, that they must accept all of the federal regulations attached to that expansion. Now, that too has had a profound effect on what is happening to healthcare in this country. Supreme Court, unfortunately, because we have such a divisive society right now, where there's no middle ground, many of these decisions are going to be decided by a Supreme Court. And so this is absolutely critical, and I'm going to share with you a couple of other decisions that the Supreme Court weighed in on that loom heavily over healthcare right now and going forward in the future. And then we'll talk about some of the upcoming things that are going to be coming down the pike with healthcare decisions and why the Supreme Court, the makeup of the Supreme Court is so important. So stay with us.
Hi, I'm Dr. Mike Karuchak. Join me and my co-host, Dr. Hal Scherz, as we talk about the topics that doctors talk about amongst themselves, such as Medicare, Obamacare, alternative forms of care, and health information technology. Join us every Thursday morning, 8 to 9 a.m.
The Docs for Patient Care Foundation is your way to join the fight and become a member of an organization created by doctors for patients dedicated to fighting for your healthcare freedom and preserving the doctor-patient relationship. Get a pen and paper. Write down www.docsforpatientcarefoundation.org. That's www.docsforpatientcarefoundation.org. Go to our site and please make a generous tax-deductible donation and join the fight today. Thank you.
You're listening to America's Web Radio on the AmericasBroadcastNetwork.com. Thank you for listening.
We're back in the Doctor's Lounge, and we are talking today about the impact of the Supreme Court on healthcare in America. What has happened, the impact it's already had, and the potential impact going forward. And why it's so important that we get a ninth judge on the Supreme Court and somebody who is actually interpreting the law as spelled out by the Constitution and not changing things and interpreting it in a leftist fashion and a woke society as we're seeing. And I wanted to, I had a open question in the first segment about the makeup of the Supreme Court, and our crack research team, headed by David Moxley, came up with the answer, which is that the Constitution does not specify the number of judges, that only the House of Representatives can change that number. But if you think for a moment that all bets are off and the left would not completely change all of the institutions in this country and throw everything out the window to get their way, then you have not been paying attention to what's going on in this country. And they very well might go ahead and with a Republican House, Republican Senate, and a Democratic House, a Democratic Senate, and a Democratic White House, change the number of justices on the Supreme Court so that they can get through their leftist agenda. And that's the danger of what's happening right now with the extreme left completely taking over the Democratic Party. And if and the people who say that it's not happening are just they're ostriches. Their heads are buried in the sand, because that's exactly what's happening. The other big case that the Supreme Court, or cases that the Supreme Court had an impact in within the last 8 years, was the Burwell versus Hobby Lobby case. Just to explain to you what that means, what that was all about, in 2014, a case made it all the way to the Supreme Court that centered on contraceptives. Now, the Affordable Care Act, there were provisions in there that excluded businesses, institutions, privately held institutions, religious institutions from violating their religious beliefs and doing things that were against those beliefs. And in the case of Hobby Lobby, which is a privately held corporation, they provide health care to their employees, but they did not want to have contraceptives and abortions as part of the health care provisions that they gave to their employees. It was against their the religious beliefs, and the government came out against them. They threatened them. They filed lawsuit against them, and Hobby Lobby fought the government, and they took it all the way to the Supreme Court and won. And they upheld the right of a private corporation to that provides health care to be able to decide whether or not some of the provisions violated their religious beliefs, which are supported by the Constitution. And the Supreme Court voted in their favor. They did the same with the Little Sisters of the Poor, which is an order, a Catholic order, that gave health care, that provided health care to a large segment of parishioners in Pennsylvania and New Jersey. And the states said that they could not they could not follow their religious beliefs, and they were obligated to give certain contraceptives. Most importantly, they objected to the morning after pill, and again, the Supreme Court they voted in favor of the Little Sisters of the Poor. So the point is that these healthcare decisions that have been made came from statutes that were part of Obamacare that violated constitutional rights of segments of our society, and the state tried to overturn constitutional rights, constitutional things that the Constitution grants to every single citizen, and fight them on this. And that's why strict constructionists of the Constitution are necessary on the Supreme Court to protect the constitutional rights of every American, and not to violate those rights because society is changing, and because the views of a few who have the loudest voices on the left are claiming that the views of the few are more important than the rights of everyone. So here we are now, getting ready to have another contentious fight. It's going to be interesting what happens on Saturday of this week when President Trump fulfills his promise to nominate a justice to fill Justice Ginsburg's seat, which incidentally did not belong to her. And so the left is saying ridiculous things, that on her deathbed she said that her greatest wish would be to have the next president pick a Supreme Court justice. She has absolutely no vote on that one, no right to say that, and the left has no standing in terms of honoring that deathbed wish. She can't make that. This is not a seat that belongs to her. This is a seat that belongs to the people, and this is the law of the land based in the Constitution, that the president has an obligation to vote or to nominate a person to take over a seat of a departed Supreme Court justice, and then it's up to the Senate to decide how quickly to get them to get the vote to the House. And it's not unprecedented to get votes to the House quickly. In the case of Ruth Bader Ginsburg, She was her nominee from the time of her nomination till she was voted happened in under 40 days. The same is true for Sandra Day O'Connor, under 40 days. So it is not unprecedented to get a nominee through quickly. There's a gigantic upcoming Supreme Court case that's going to be held or heard right after the election. And it is California versus Texas. And what this case is, it is the case to decide if the Affordable Care Act should remain in place. It was a suit that was brought by Texas, 19 other states, and 2 individuals in early 2018. The claim was that in 2017, President Trump had there was a bill that passed. It was the Tax Cuts and Jobs Act, and it rendered the Affordable Care Act's individual mandate unconstitutional because the mandate could no longer be justified as a tax after that act reduced the mandate's penalty to 0. So in 2012, when the Supreme Court said that the mandate was a tax, they claimed that it was the purview of the Congress to tax, and so the mandate being a tax meant that the law had standing. Without a penalty, there is no tax. And if there is no tax, then the mandate is unconstitutional. You cannot force someone to purchase something, to engage in commerce against their will. And so if there's no penalty, then the mandate has no standing, and the entire bill needs to be thrown out. Now, the states argued that the mandate was essential for the rest of the Affordable Care Act. And so the entire Affordable Care Act was therefore invalid if the mandate was unconstitutional. The other side claimed that there is severability. So what is severability? It means that if a part of the law is struck down, does it mean that the entire law gets struck down, or can you separate that portion from the law and still allow the rest of the law to stand? And so California and other states with Democratic attorney generals are on the other side, saying that the mandate can be invalidated, but the law should still stand, that there is severability. And so there is this looming fight that has made it all the way to the Supreme Court, and the Supreme Court will decide if, number one, the mandate is unconstitutional because it is no longer a tax, and number two, if there is severability. And so I can tell you how 3 justices are going to vote on either side. We can predict that Justices Breyer, Kagan, and Sotomayor are going to say that it is unconstitutional, that the mandate cannot be enforced because it's not a tax, but there is severability. And so the law continues to stand. Justices Gorsuch, Kavanaugh, and Alito will likely, and Thomas likely will vote that this should be struck down and there is no severability and the Affordable Care Act should be thrown out. John Roberts is the wild card, just like he was before. And if he is going to be consistent with his previous decisions, he is going to vote with the left-leaning judges, and it will be a 4-4 tie. This is why it is so imperative to get a conservative thinking justice on the Supreme Court and make this a 5-4 decision against allowing Obamacare to stand. Because Obamacare, people are trying to claim that President Trump's trying to take away their health care by fighting Obamacare, and that's more lies from the left. It's just not true. And there are other ways to deliver better health care than the poorly constructed Obamacare plan, which incidentally has resulted in premiums now rising to as much as $26,000 to $28,000 a year, not including deductibles, not including copays. And so people are being aced out of healthcare plans around the country if they can even afford them. So this is the challenge about getting a ninth Supreme Court justice on the bench and getting somebody who is going to look at the constitutionality of this law, and which is, in my opinion, it is clear cut that Obamacare was unconstitutional from the outset and needs to go. There are other potential Supreme Court cases that having the right justice on the bench is going to have an impact on. I'm not sure that they're going to necessarily be heard by the Supreme Court, but they are on their way towards the Supreme Court. The Supreme Court decides what cases they're going to take up and which ones they are not. So these are cases that have all made it through lower courts and in the federal system and may be getting to the Supreme Court at some point. Most notable is Stewart versus Azar, which is a group of low-income residents in Kentucky challenged the Trump administration's move to allow Kentucky to impose work requirements on enrollees in the state Medicaid program. So if the state of Kentucky is saying that we will give you Medicaid, but you have to show that you have attempted to find work or are working, these individuals who are suing Kentucky say, no, there's no reason why we have to work to get Medicaid. Why do we have to work? And so this is important because the federal government has not historically allowed states to make work a condition for receiving Medicaid. But starting with Kentucky, the Trump administration has approved other states' work requirements for receiving Medicaid benefits. Now, is that a bad thing? Is it bad to require people to either work or show attempts to find work rather than being wards of the state and sponging off taxpayers who are responsible for their health care? Of course it's not. And this is an important case because the Supreme Court will decide whether or not states have the right to impose work requirements because they're the ones who are on the hook for the majority or a good portion, not the majority, but a good portion of the cost of their Medicaid programs. Another case that's making it up towards the Supreme Court is New York versus Acosta. Now, what this is are 12 Democratic attorney generals who are challenging the Trump administration regulation that makes it easier for individuals and small employers to band together to buy the association health plans. The association health plans are awesome. The association health plans are ways that individuals and businesses can band together to create critical mass and go to insurance companies and get better breaks on their insurance. What is wrong with that? That's actually a great thing. This is another one of the innovations to give individuals in this country better health care, better opportunities to find their own health care requirements. It limits what the state, what the government is doing. And this is always a good thing, to limit what the government is doing. What the claim by these attorney generals is that these plans violate the, quote, minimum requirements of Obamacare, which we know were an overreach and nonsense, making the insurance plans far more expensive than they need to be by making people purchase services as part of their insurance that they would never need or never use. So this is an absolutely critical case that the Supreme Court needs to weigh in on, and they need to weigh in on the right way if it makes it to the Supreme Court. Here's another one, and this is one of several cases. This is the West Alabama Women's Center versus Miller. And what this case is about is abortion. Alabama passed a law that bars providers from doing dilatation and extraction in the second trimester. And this is an attempt to try to stop a practice that is a midterm abortion. It was challenged by the abortion providers in the state of Alabama. So this is one of many cases that are going to be heard in lower federal courts that are going to make it up to the Supreme Court. The Supreme Court is going to pick an abortion case. I don't know which one it will be, whether it's going to be this one. There are other abortion cases that are requiring providers to have hospital admitting privileges if they do abortions, and that's being challenged by several states' abortion providers, I think in Louisiana and in Texas. What that means is that if you provide abortion services to individuals, that if something goes terribly wrong, that you have to be able to bring that patient to a hospital where you have admitting privileges so that you can continue to take care of that patient. And what these abortion facilities are saying is that they're treating it like McDonald's, where you drive through, get your abortion, and if you have food poisoning, well, go to the emergency room and get taken care of. And this is a major problem. As a medical provider, I would agree that if you're doing a procedure and something goes wrong, it's your responsibility, and you need to make sure that you're taking care of the complication that you created. And that's something that is just a basic tenet of medicine and of healthcare. And I think it's malpractice otherwise. And so this is going to be a case that will possibly be the one that's heard by the Supreme Court, one of these states. And then there are the other abortion cases, of course, where there is anti-abortion advocates that are that in states where there is Republican legislatures, that they want women to be able to see the ultrasound or hear the fetal heartbeat or see the 3D ultrasound of the baby before the abortion is done. and there are abortion providers who feel that that is too much of a psychological trauma for the women and that should not happen. And so there's a contention on both sides, and that case is more of a long shot getting to the Supreme Court. I think the one about admitting privileges has a far greater chance of being heard by the Supreme Court. Finally, a case that's more of a long shot that probably won't get to the Supreme Court, but is out there, is Columbus versus Trump. What that case is about is the city of Columbus, Ohio, and a group of other cities that have filed suit against the president, suing him, alleging that he is deliberately undermining the Affordable Care Act, thereby ignoring his constitutional responsibility to enforce the law and subjecting Americans to higher health care costs. That case is a very, very big, long shot. But these are the cases that unfortunately are being brought against the president by his against his administration, against people who are challenging the push to the left for more government control over health care. So I've spent this hour trying to explain the importance of having, number one, an odd number of justices on the Supreme Court. We cannot leave these decisions in a 4-4 limbo. And number two, making sure that we have the proper makeup of the Supreme Court. And people who are alleging that having conservatives on the Supreme Court is dangerous for this country are lying to Americans. The danger is having leftist judges who are changing America, who believe that America is a bad country, just like the woke left is saying on MSNBC and CNN every single day, saying, basically lying to this country and saying things that are untrue and showing clips that are doctored clips so that they can rev up ill-informed people in this country into a frenzy so that they believe that the president is a criminal and that people who follow him or who believe in the Constitution are white nationalists. Those people are the danger to America. And having the Supreme Court as the guardrail against these people is so critical that the importance cannot be overstated. So this is why healthcare and the Supreme Court, this is where the healthcare and the Supreme Court intersect. And stay tuned for what's going to happen over the next few weeks. I think it's going to be a wild ride. So thanks for being with us today in the Doctor's Lounge. This is what we're talking about in Doctor's Lounges. And join us next week with Dr. Scott.
You're listening to America's Web Radio on the AmericasBroadcastNetwork.com. Thank you for listening.
The Docs for Patient Care Foundation is your way to join the fight and become a member of an organization created by doctors for patients, dedicated to fighting for your healthcare freedom and preserving the doctor-patient relationship.